So let's begin today's program. Om Shri Gurubhyo Namaha. Om Shri Bhavani Shankaraya Namaha. Om Shri Matre Namaha. Jai Shankar, Hari Om, good morning, Namaste, and Salam to all those who are joining today. At the outset, I would like to thank Chitrapur Heritage Foundation and Saraswat Foundation for being partners and supporting this initiative. Let's face it, we live in a world that often prioritizes appearance over health and our senses. Therefore, many of us end up focusing more attention on how our body parts look more than whether they are functioning as they should. While taking pride in your appearance can be a great and productive source of confidence, it is very important that you remember to maintain good bodily health at all stages of life. After all, there are some things that can't be covered up so easily, especially a deterioration of your senses. Each of your sense is linked to a main body part. So it's essential that you nurture this area in order to maintain good sensual health throughout your entire life. Let's start with a sense that we actively use from the moment we are born or during our day. We open our eyes in the morning to the moment that we close our eyes at night. Our sense of sight. Now, having good eyesight is extremely important when it comes to maintaining a good quality of life. Our eyes are often considered the window to a person's soul. But more importantly, they are an individual's means of seeing the world around them. Sight is invaluable, though hundreds of thousands of people do manage to function well without it. It's always preferable and more beneficial to your well-being to have good vision. However, if you can avoid deterioration of your eyesight, you should try your best to, as having poor eyesight or no eyesight can make life a lot more difficult. Here in North America, we are familiar and forced a visit to our optician annually or biannually. During this visit, the optician or a professional optometrist will conduct a full eye examination, taking a look at the overall health of your eye from front to back, ensuring you can carry out certain visual exercises, reading, and to determine whether you need prescription lenses for long-sightedness or short-sightedness. Now, a first step on your journey to good eyesight would be to carry out eye exercises. Not many people have heard of the concept of eye exercises and will ask, do they really work? In short, the answer is yes. There are muscles within your eyes, and exercising these can help to improve your eye movement. Now, let's listen to eminent occupational and yoga therapist on how low vision can affect our quality of life and how an occupational therapist can help you. Low vision can cause difficulty in seeing detailed letters and numbers when reading. Recognizing the slope of a curb, steps, or facial features, and distinguishing between similar colors such as black and blue. Adults who have these problems may have trouble maintaining their independence and completing typical day-to-day activities. It is possible for people with vision impairments to continue to live independent and meaningful lives with the help of an occupational therapist. Practitioners can help people with low vision to continue living in their own homes and complete daily tasks such as showering, dressing, cooking, grocery shopping, managing finances, and getting around in the community. Today's program is very unique and has been planned as a chat because we thought, given that the topic is low vision, any visual distraction is not recommended. House rules, we ask that everyone remain on mute and only unmute when you're speaking or called upon. For that purpose, please ensure that you have the correct name displayed. We'll be using the raise hand function when you want to ask a question, most probably at the end. Please type your questions into the chat window during the Q&A portion. We ask that everyone participate with respect for one another and in the spirit of community. Oh, that's long, probably longer than Krishna Pachi's seminar. Mrs. Krishna Rao. Oh my God, where do I begin? She is my best friend's wife. Shreyas is my best friend, and they live in New Jersey. And they were the first ones to bless us when me and at that time my fiance wanted to get married in Abu Dhabi. They were the first ones to bless us. Mrs. Krishna Rao, she is an occupational therapist with bachelor's degree from GS Medical College, KEM Hospital, and master's from LTMG Sion Hospital, both Mumbai. She has worked in Sion Hospital before leaving the country 33 years ago. Her husband, Shreyas Rao, an engineer, very, very smart engineer, very loving, caring, has a global role and has traveled extensively. Shreyas's father, Prabhakar Rao, me and my kids lovingly call him Aja, was the principal at Somaya College, and Shreyas's mom, Tara Rao, Nee Karnik, was headmistress at OLGC, Our Lady of Good Counsel. Krishna's parents, Gurda Shirur and mom, Suniti, and she was brought up by Prabhakar and Shanti Upponi in Mumbai. Krishna is fortunate enough to live in a couple of those countries where Shreyas has traveled before settling down in New Jersey. Their son and daughter-in-law, both engineers, live in California. Krishna has been working as an occupational and yoga therapist in the geriatric setting since the past 19 years. She's passionate about her work and loves working with this generation. She loves listening to the life stories and get a lot of strength and wisdom from their rich experiences. Now I hand off to my good friend, Krishna Rao.
Hello, everyone, and namaskar. Mahesh, thank you so much for that wonderful, wonderful introduction. You almost did everything that I was going to say. So I hope it's not a repetition, but thank you very much. I'm very obliged that you gave such a wonderful introduction as well. So a positive attitude and a readiness for change will influence our ability to overcome any loss, be it vision or otherwise. I'm here to speak with you about low vision and what occupational therapy can do for you to live life to its fullest. A brief background before I get there. Some numbers might be boring, but it is important to listen to them. According to CDC, approximately 14 million people in the United States over the age of 40 have vision impairments. In 2015, there were an estimated 253 million people with visual impairments worldwide. And per a study in 2017, 1.5 million Canadians identified themselves as having sight loss. A study in 2019 said the burden of visual impairment in India was estimated at 62 million. Of these, 54 million have low vision and 8 million have blindness. So clearly, vision loss ranks among top 10 causes of disabilities and is a condition feared by many. The prevalence of low vision increases with age, with 1% of people in their late 60s to 17% in their 80s and older. Low vision has detrimental effects on our independence. I'll be talking more about these and how to overcome them in just a few minutes. So, what do some of the common terms mean, and precisely what is low vision? So, low vision refers to vision that cannot be corrected by regular glasses, contact lenses, medicine, or surgery. There are 4 different levels of low vision. Partially sighted means exactly what it says. A person has partial vision in one or both eyes. Low vision refers to severe impairment in which the visual acuity 20/70 or poorer in the better seeing eye, and it cannot be improved by glasses or lenses. Legally blind means a person has corrected vision of 20/200 in their best seeing eye. And the 4th category is total blindness. It refers to complete loss of vision. Often you must have heard the term visual acuity. This is the measurement determined by the letter chart test we take when we get our eyes checked. The number represents your eye's clarity or sharpness. So, for example, a person with a visual acuity of 20/70 is standing 20 feet from the chart and sees what a person with a perfect 20/20 vision can see from 70 feet away. Visual field is the range or area of vision a person can see when his eyes are fixed at one point. What are the most common causes or conditions that result in low vision? The National Eye Institute identifies 4 common conditions that account for 75% of age-related vision deficits. The first one is age-related macular degeneration. Damage to the macula, which is the functional central area of the retina, causes macular degeneration. This results in blurry, dark portions of the central vision. Medical treatment can slow the effects but cannot reverse it. Macular degeneration affects reading, writing, driving, seeing faces, dials of appliances, pouring a glass of milk or juice, any fine detail, acuity, color, and light. It is the leading cause of low vision. Easy way to remember is what affects your heart affects your eyes. Some contributing factors are high blood pressure, high cholesterol, and some modifiable risk factors are lifestyle habits like diet, exercise, and weight control. The second condition is glaucoma. Glaucoma is increased pressure causing damage to the optic nerve. This results in loss of peripheral vision, which is also known as tunnel vision. Medical treatment can stop or reduce the progression of this disease. Glaucoma reduces your ability to see items to the side, impacting balance, navigation, and body awareness. This could cause frustrations while locating food in a dimly lit pantry, walking on unfamiliar terrain, or missing items on the edge of the table. Glaucoma is also one of the leading causes of low vision. Regular eye exams help to diagnose and provide early treatment to preserve vision with eye drops to reduce the intraocular pressure. Risk factors are high blood pressure, diabetes, heart diseases, or hypothyroidism. Cataracts. These are proteins clumping together, clouding the lens, thereby decreasing the amount of light passing through the lens of the eye. Medical treatment involves surgery to replace the lens. Cataracts blur all vision in the affected eye, causing interference with daily activities. Glare and double vision may also be involved with this disorder. It vastly impacts reading, writing, and all daily tasks. Last but not the least, diabetic retinopathy. This presents as blind spots or floaters throughout the visual field. High blood sugar levels can cause damage to the blood vessels that feed the retina. Medical treatment includes controlling the diabetes with medicines, diet, and exercise. These treatments can stop the progression of the disease and subsequent eye disorders. Diabetic retinopathy causes visual impairments varying from person to person. Depending on the severity, it could result in difficulty writing a check, judging the quantity of water in a glass, or reading the markings on a syringe. Modifiable risk factors are undiagnosed diabetes, poorly controlled blood pressure or glucose, lack of exercise, poor diet, or obesity. So, whether you're newly diagnosed or have been living with your visual impairments for a while now, your low vision team who can authorize occupational therapy will consist of an optometrist or an OD, who diagnose, treat, and manage visual disorders. He or she is your primary healthcare provider for your routine eye care, such as an yearly eye exam or refilling an eyeglass, contact lens, or eye medication prescription. Sorry. An ophthalmologist or an MD is one who provides diagnosis and prognosis of the disease process. He or she can perform medical or surgical interventions for serious eye conditions such as cataracts or laser eye surgery. A physiatrist is a medical doctor who has completed training in specialty of primary medicine and rehabilitation. They treat a wide variety of medical conditions holistically with a multifaceted approach to care in combination with rehab. And of course, your primary care physician, who is your first contact for any health concerns, as well as continuing care of varied medical conditions. Once you get a prescription for low vision rehab from any one of these, now is the time to see your friendly neighborhood, not Spider-Man, but occupational therapist. So, what does an occupational therapist do for low vision? Or precisely, what should you expect from a visit to the occupational therapist? After you get a prescription from any of the doctors just mentioned, you make your first appointment with an occupational therapist for an initial evaluation. Let me tell you how it works in my neck of woods. I am sure it is not far too different in your areas, geographical areas, but generally this is how I would go about doing it. In my initial assessment as an occupational therapist, my focus is to find your functional abilities and limitations. We also look for factors like sensory body functions, habits, routines, roles used in daily tasks, as well as physical and social environments. We look for performance skills, as in motor skills needed to grasp or manipulate objects. We look for processing skills, such as navigating and organizing. We also look for cultural and personal interactions, which may be the underlying reason for withdrawal from desired activities. Low vision could cause people to experience difficulty reading facial expressions or interpreting body language, which further complicates their personal interactions, making social situations awkward and uncomfortable sometimes. As OTs, we also collaborate with your optometrist, your ophthalmologist, and provide skilled training in functional use of devices prescribed by them. These devices may include magnifiers, readers, CCTV, and or digital accessories. Your cell phones could be one of them. The top functional complaints among people with low vision include difficulty reading, writing, signing checks, recognizing faces, and performing home activities. These home activities could be walking, shopping, meal prep, cleaning, and self-care. Older adults with low vision report not only these difficulties, but also higher levels of depression and anxiety. Clearly, the impact of low vision on independence and quality of life is profound. Generally speaking, on our first meeting, you and I make goals by recognizing these self-reported limitations to make changes in the areas of life that are meaningful and purposeful to you. My role is to make recommendations which are functionally focused to make your life slightly easier, a lot more safer, and as independent as possible. You don't have to stop enjoying your favorite activities, and as occupational therapists, we strive to help you learn to manage them better. So, some of the ways we OTs can help people with low vision would be prevent accidents and injury by recommending lighting effective for particular area and activity, recognizing potential hazards and offering solutions, and showing different ways to do something safely. We teach new skills with techniques such as eccentric viewing or visual tracking to help people learn to use their remaining vision more effectively and efficiently. We can modify task or environment with adaptive equipment and or use of low vision tools such as magnifiers and others. Promoting a healthy and satisfying lifestyle with a holistic approach that helps clients participate in all things that they want to and need to do. So I'll give you some examples. If you want to improve visibility, your hearing aid battery knob can be marked with a bright color to provide a contrast. We could use night lights or flashlights and avoid moving quickly from dark room to a lighted area and vice versa at nights. We could use overhead lighting to eliminate shadows, use shades to reduce glare, could use a gooseneck lamp for tabletop activities. If you want to manage medications, ask your physician and pharmacist for large print labels. Mark each pill bottle in a distinctive way. Example, a rubber band on one bottle, a Velcro on the other, a felt tip, or buttons or bump dots. So you can differentiate different medicines. If you want to function in your home easily, First and foremost criteria, remove clutter, cords, and throw rugs to prevent falls. Use labeled tray dividers to hold small items or cosmetics. Hang clothes by colors and commonly used items in a same easy to access location. If you want to shop for groceries, make a list according to the aisles if it is your familiar superstore. Advocate for yourself and ask assistance at the courtesy desk. My own personal experience in a new store is I go to the customer service with my list and a pen. I ask them where I can find these items, put the aisle numbers, and then go from one end to the other and then check my list. That's a way to go about. If you want to prepare meals, keep items in the refrigerator and cabinets in an order that seems most natural to you. And try to store them only one row deep. I don't know how far that'll go, but it's just easier that way. Mark appliances with bump dots. Use microwave if you feel unsure to use a stovetop. If you want to manage your finances, you want to organize bills in different colored trays, like an in and out or whichever works. Use large print checks, signature guides. I like to say you want to fold your dollar bills or your rupee bills differently. Like a $20 would be long folded in your wallet or purse. A $10 would be folded in half, in the short half, and quarters for the $5 bills or whichever works for you. So different bills in different folding in your wallet. So you don't have to fumble at the counter. So, in conclusion, there is strong evidence supporting the role of occupational therapy for older adults with low vision. Most insurances will cover occupational therapy services for low vision. The routine use of low vision occupational therapy will enhance daily activity performance along with leisure and social participation. An occupational therapist helps people function at their highest possible level by preventing accidents and injury, and all those examples that I gave you before. We want to promote a healthy lifestyle, as in ensuring, most importantly, you participate in all your favorite activities. An occupational therapist is your professional partner in living life to its fullest. I thank you all for having me here. And Mahesh, I leave the podium to you if you want to open it for questions. Thank you very much.
Thank you, Krishna Pachi. One of the things that probably missed out of your list where you were saying some of the things that you need to take care of at home is sharp edge furniture.
Yes.
That is very important. So we tend to keep all our furniture. So we need to make sure there are no sharp edges because
absolutely, yes.
Even a slight fall can become an hazard for lifelong, right? So that's one of the things I just wanted to mention. Again, thank you so much. I just want to say, let's all pray. Aja is in the ICU, but your commitment and that you agreed to keep up your promise and do the presentation. I'm very thankful to you and Shreyas. Okay, and so now I will ask everybody to unmute yourself, or let's do one thing. Let me finish my vote of thanks. And Arun Ma'am, you're there? Okay, so I would like to thank all of you for attending today's session. And this session is being recorded and will be available on our Sacha website, which is our not-for-profit organization that seniors run. I don't do anything. It's just my platform. And all our seniors who are here, Shanta Pachi, Nandini Pachi, Lata Pachi, they run it. So it's all for your benefit. And thank you very much for being here today. Arun Mam from Chitrapur Heritage Foundation and Sandeep Dhareshwar Mam is also here from Saraswat Foundation. Both are in the US. I just wanted to add before I forget is the concept of low vision and occupational therapy is, I think, a little bit rare in Canada, because I went to the Occupational Association of Toronto and I found only one occupational therapist who is certified for vision or low vision, whichever way. So this is more helpful for the folks from the US, because you can help them. And if you
Yes.
have, so that's one thing. And now Arun Mam wants to say a few words. So I will just ask him to unmute. Arun Mam, unmute yourself. Yeah. Oh, sorry. Yeah. Oh,
Okay.
yeah.
Can you hear
We can
me?
hear you.
Okay. Jai Shankar, Mahesh Mom. Thank you, Dr. Krishna Pachi, for excellent presentation. I enjoyed it very much. You really opened my eyes. I mean that. Also, thank you, Mahesh Ma'am, for giving us Chitrapur Heritage Foundation the opportunity to sponsor such a wonderful, informative program. It was really a unique presentation. I really enjoyed it. Now, quickly, I want to, regarding Chitrapur Heritage Foundation, I know people are waiting for us asking you, Krishna Pachi, a lot of questions. So I'll keep it very short. It is a not-for-profit organization based in Pennsylvania, USA. Right now, we are raising money for 3 specific areas for COVID relief and donating through Sri Chitrapur Mutt's social initiatives with the blessings of Param Puja Sri Sadhujat Shankaracharya Swamiji. These areas are health security, providing critical equipment like oximeters, and also helping people to get vaccinations. The second is food security. A lot of Amchi families have lost their jobs and they're struggling. And Amchis are normally very bashful to come out and admit that they have financial issues. But surprisingly and luckily, they have come out this time. And we have a lot of families who are asking for support, and we want to help them. And these are all qualified families, and they're in different areas, rural, urban, as well as semi-rural areas, urban areas. And the third areas we want to do is educational security. We want to help the underprivileged kids by paying their fees, as well as teachers by paying their salaries. We are also looking into a new initiative to supply tablets to students so they can access learning online. Last year, with your help, CHF donated over $500,000 to Chitrapur Mutt initiatives, including Vantiga. This year, we have a goal of raising $1 million. So please donate generously. Please visit our website, www.chfusa.org, and please help us help. Thank you. May Lord Bhavani Shankar's and Pujya Swamiji's blessings always be with you. Thank you. Thank you.
Thank you, Arun Mam. So we have Krishna Pachi, we have a question
Sure.
So the question is, my 18-year-old niece has bad vision, I think -8, with very high negative power and special lenses. Just want to know if something can be done.
I think the best thing to do would be to follow what the doctor said, follow with what the eye doctor, the eye specialists have been saying. Definitely, there are exercises that you could do to retain the vision that she has. I can actually email Mahesh a few of them, and then he can, maybe Mahesh and Manisha, if you can forward it to the rest of them. There are a few exercises that will help her uh, retain what she has and to defer the progression of the glaucoma. Is that from glaucoma you said,
No,
or
it just
just?
niece has bad vision,
Yeah, I think
negative power and special lenses.
right. I think the best way with that kind of vision impairment would be surgical, which might laser, or I'm not sure which the eye doctor would recommend, but that would be a way to go. And absolutely, anything that helps, exercises, palming, and massaging, and that those are the things that we do when people come to us for low vision as a low vision OT, is we find out what the deficits are, and then we kind of, Mahesh, you said it very rightly, there are ocular muscles that can be strengthened, that can be relaxed, that can be massaged, that the eyes, sometimes people have dryness, they can be moisturized naturally. You're in a supermarket, or you're at a show and you don't have your eye drops. We have ways and means to moisturize them temporarily, but those are like finer details that we do when they come to us.
Thank you. Thank you.
Sure, sure.
The next question is, I have glaucoma more in the left eye and I'm using 3 types of drops. Is it okay to use cell phone?
Actually, with any kind of eye problems, I think the best way would be to use a cell phone is to not hold it down here, is to hold it up at your eye level. So the way to do it would be to sit up in a recliner, or put pillows on. You want to enlarge the print. The blue light generally not very good at nights. The font, if you can enlarge the font, that would be good. The glare, the brightness, the darkness, those are things that you could modify in your cell phone. I would say the more finer the print, the harder for the eyes to kind of focus, to kind of grasp. Sometimes you tend to do it by context. So it's easier if you have it higher, bigger fonts. Black print on white background works the best, but we also have, I don't know how the cell phones work, I'm not very good with technology, but we have readers that they have different modes. So we can have a yellow background with a black font. Sometimes that works better. Sometimes we also recommend like a yellow, they're not sunglasses, but they are glasses for glare. So they have a yellow tinge. So if you wear those, sometimes it helps reading smaller print.
Thank you. The
Sure,
next
sure.
question, I think, is everybody wants to ask, but is shy to ask, is including me, is it okay to use cell phone at night while lying down?
I think I have other reasons than low vision for not using it.
Yeah.
I would say preferably not. If you really have to, and I know life happens, we work all day, and then the only time we get to browse on our email or our WhatsApp or text messages is at night, I won't say don't use it, but
Yeah,
but
it's tough. I
it
don't
is
think
tough.
anybody's going to listen to what you say in that matter,
Exactly.
including me. uh,
So
uh,
I
so,
would suggest have and this is for any kind of reading. Uh, we normally recommend what is called a gooseneck lamp. So you want your light to come from your left shoulder, and then you're reading with your, so that's the light. I generally we have found that that works the best. Again, if you have to use, I would suggest maybe an iPad or something that's bigger.
bigger.
Yeah, because when you're using a cell phone, your eyes are kind of concentrating, your focus, they're working harder than if you were, say, on a laptop or an iPad or a desktop, or even a reading book.
Yeah.
Reading a book at night. Some people have a habit of reading at night before going to bed. I suggest putting it up, sitting up with your headboard behind, put pillows, put your head up. It is also good for your neck because, and this is as a general rule, I tell people because I work, in a facility with 80, with the average age is 84. Generally speaking, I'm thinking even the younger generation is now looking down at their cell phones. So it adds a lot of burden on the neck. So
Backbone.
we see a lot of neck pain and neck disorders as well. So I would recommend keeping your cell phone up at your eye level. How practical, I don't know, but try to do it.
Thank you. I have one more question. Before that, I would like to ask Ashwin Hosangdi ma'am if you would like to say a few words about Saraswat Foundation. The question I have is, summer is coming and we back home are not used to using sunglasses. We tend to just walk out in the sun and then we realize, oh my God, this is so bright, and
Yeah,
it affects, right? So I just wanted to know, what do you suggest? I mean, how important is a sunglass to our vision?
sure. Me?
Yeah.
Okay. Yes. Because I thought. So,
84
yes.
year old.
So yes, absolutely, absolutely. I mean, you want to protect your eyes when they are good, so that they'll help you when you get older. So sunglasses, definitely yes, and brimmed hat. Those are good uh, things to go when you're getting into a hot sunny area. We also start, when people come to us for treatment as such, we also give them a couple of tips which I would love to share with all of you is we start our day with washing our eyes, which is a normal thing, everybody does that, but just kind of splashing your eyes, cleaning the debris from the night over. And you do the same thing before going to bed, is to clean up your eyes, and then it kind of refreshes them. It helps them with maintaining their whatever power they have. The second thing I like to say is palming. We are so, as you correctly mentioned, Mahesh, in the beginning, we are so into technology and cell phone and everything is eyes, eyes, eyes. We never seem to give them a rest. So if you have the time, I can show you a quick, very, very simple, um, I won't say exercise, but it's an exercise. So, so everybody, I want you to sit up nice and tall. And if you have pillows on your lap, that's good. If not, lean over so your elbows rest on your thighs or the countertop or table or wherever it is. You're going to do your palming. I'll show you what I need you to do, and then you do it. I'm going to close my eyes. I'm going to take the palm and keep my closed eye in the middle of my palm. You do this for a count of 10 seconds. So everybody rest your elbows, because the main idea is to relax your forehead on your hands, and your hands are rested somewhere, so you're not holding your head up. So you do this and you put your eyes, close your eyes. Let's all do that for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you can open your eyes. All you should be able to see is blackness when you are doing palming. This is an exercise I love to tell people to do it every time they have done a lot of computer, a lot of reading, a lot of writing, a lot of, anything that's very continuous and repetitive.
Okay, thank you so much. Thank you so much. Yeah,
Pleasure.
for people, especially who are stuck to computers like me, I think we need this. So before we end the program, I would like to request Sandeep Dareshwar Ma'am to say a few words about Saraswat Foundation.
Thank you. Thank you, Mahesh, and thank you, Krishna Pachi. Namaskaram and Gurbhyo Namo, Jai Shankar. Very, very insightful program. I'm glad I attended. And I think to me, this program is not just for seniors. I think it's for everybody, because, hey, for everyone, age catches up, before you realize. So I think this was very insightful. Thank you very much. I'm speaking on behalf of Saraswat Foundation. Ashwin, our president, is also here. We are thankful for getting this opportunity, and I hope we get an opportunity to do partner on events like this. Please go to saraswatfoundation.org to learn more about us. We are a nonprofit for 35, 40 years based here in Pennsylvania, and we support a lot of non-religious philanthropic activities back in India, like poor students, blind people, old age homes. We even support a lot of the mud-related, non-religious philanthropic activities. So a lot of different things. But other than that, recently we also have started partnering with a lot of organizations here in US for, doing our bit for events like this. And it's I think the more we do this, the more it is better. So I'm glad we got this chance. I hope we get a chance in future. I wish all of you a not only healthy eyes, but healthy body, healthy mind, healthy spirit, and good times to years to come. Thank you, Krishna Pachi. Okay.
Thank you, Sandeep. Thank you so much. So in conclusion, thank you again, Krishna Pachi and Shreyas and Aja. Get well soon. I'm going to unmute everybody. So everybody, if they want to ask a question or talk to you, they can. And if you have any further questions, you can always email me and I will forward it to Krishna, and then we will get an answer. Okay. Thank you.